Hello everyone, you're welcome to Akoko Africa Radio UK. This is Health Time, Health Talk with Atswei. We are a bit late today because we got our timing a bit, because Ghana is running behind us 1 hour. We didn't get it right, so I'm very sorry. I apologize for that. Today we have Reverend Dr. Sasu coming back with another interesting topic. Last time he talked to us about kidney disease in children, which we really learned a lot. And today he's coming to talk about diabetes. I know maybe you already know about it, or you don't know much about it. Maybe you have diabetes, or you know someone who has it. I'll plead with you to make time with us this evening to listen to what he has got to say. He's going to tell us what it is, what causes it, how it can be prevented, or how we can manage it, and almost everything that you need to know about diabetes today. If you are free, you can stay with us for the hour to listen to this. If you're not, you can always go back to our channels to listen to this, because it will be on YouTube. And our previous programs are all on YouTube, so you can always go back and listen to them. We are already late, so we're not going to take much of your time. So I will use this time to we'll have to get a message from our sponsors, and then we'll invite Doctor to come on. Okay, thank you.
Hey there, fabulous folks. Are you ready to take your locks to new heights of beauty and vitality? Then listen up, because Tiny Hands Locks is here to make your hair dreams a reality. Located at the heart of natural beauty, Tiny Hands Locks isn't just a salon, it's a sanctuary where your locks are pampered and celebrated. Now, let's talk about our top-notch hair care services and products. At Tiny Hands Locks, we believe in the power of nature's bounty to nurture and revitalize your locks. At Tiny Hands Locks, we are dedicated to crafting bespoke lock styles that enhance your natural beauty and reflect your unique personality. From starter locks to locks maintenance, we've got you covered every step of the way. And when it comes to products, we've curated a range of natural wonders that are sure to leave your hair feeling pampered and rejuvenated. From clarifying shampoos to revitalizing conditioners, each product is meticulously formulated with nature's finest ingredients to cleanse, nourish, and protect your locks. But wait, there's more. Visit our website at www.tinyhandslocks.co.uk to explore our full range of services and products. Located at 24 Swan Close, Feltham, TW13 6PA. Just give us a call at 0783 298 9531 and we'll take care of the rest. So what are you waiting for? Treat yourself to the luxury and care you deserve with Tiny Hands Locks. Because at Tiny Hands Locks, we're not just about hair, we're about empowering you to embrace your natural beauty and shine from within. Discover the magic of Tiny Hands Locks today.
When it comes to balloons and balloon decoration for a baby Christian, for your ceiling floral, U-Smile is the place to be. For your wedding setup, your beautiful wedding setup, backdrops, and everything when it comes to planning, coordinating, and delivery, U-Smile is the best. For your indoor programs, for executive programs, for corporate events, U-Smile is a place to be. Call on us and we shall give you the best of services. Our telephone numbers are 0242571571 and also 0243639381. Our social media handles are IG U-Smile Events, on Facebook U-Smile Events, and also on TikTok U-Smile Events. Come and let's do business, and you never regret it. U-Smile, satisfaction is our hallmark. We make sure we deliver, and our delivery is always on point.
My sin
When it comes to balloons and balloons decoration for your baby Christian, for your ceiling floral, You Smile is the
Hello, welcome back to Akoko Africa Radio UK. This is Health Talk with Atswei. So I've already told you about our topic today, which is diabetes. I will invite Dr. Samuel Sasu. He's been waiting for a while now to come on, and then we start this discussion today. Hello, Doctor. Can you hear me?
Hello, good afternoon. I can hear you, please.
Good afternoon, Doctor. You are welcome again. Now you are part of us, so you are not new to this place. You're welcome to Akoko today.
Thank you.
You're welcome.
Thank you.
Hope you have a good day so far.
Likewise, please.
Thank
Likewise,
God.
please. We are
Thank
good.
God. So, Doctor, today you want us to talk about diabetes.
Right.
We would like to know, what is diabetes? What is? How do you describe that to somebody, to the layman? What diabetes is?
Okay. Thank you for the question. So, when we come to diabetes, specifically today, we are looking at diabetes mellitus.
Okay.
So there are other type and forms of diabetes, but what we are limiting today's program for is for diabetes mellitus,
Okay.
which is a chronic disease that happens in one, and it happens because of a mismatch of the insulin to the glucose in the body. So when I say a mismatch, so there could be an excess carbohydrate intake, which the insulin produce by the islet of Langerhans of the pancreas are small, or sometimes it could be due to a resistance to this insulin produce. So it's a metabolic disorder, and it is a chronic disease.
Okay.
Which occur in one, and it makes handling of sugar, which when digested is glucose, it makes it difficult for the body to do that. And when that happens, it means that, so what happens is that when one take in anything carbohydrate, anything starchy, anything that is carbohydrate content, it's digested and broken down into glucose,
Okay.
which is supposed to be absorbed into the cells. So at that cellular level, when the cells are not able to take up this glucose from the circulation, then it results in excess production of this glucose in circulation.
All right.
So that is what results in diabetes mellitus.
Okay.
So in simple terms, it's just a mismatch of the glucose produced in the body. When one is unable to regulate this metabolic pathway, then chronically or in a long term, the excess glucose that is stayed in circulation results in diabetes. And when we take your blood or your urine, then we see that the level of glucose in it is higher than what it's supposed to be.
So would you say this happens in both children and adults?
Yes. it happens in both children and adults. And the truth of the matter is that diabetes, as I said, a chronic metabolic disorder, and over the time it's progressively increasing.
Mm-hmm.
Yes, based on the lifestyle, our eating, our sedentary lifestyle, and all these things, it's on the increase. So approximately 37.3% of people in the United States and United Kingdom, the adult population, about 37.3 of them are one way or the other diagnosed with diabetes.
Okay.
Yes, so it's something which is, and unfortunately for the developing countries and the middle income countries, now the prevalence and the incidence is really increasing at a trajectory that if the education and all these doesn't come and we looking at it again, then it's going to be a great health concern. And like I said, it happens both in adults and in infants or children. Yes, because in the adult population, the common one, which is mostly diagnosed usually after the 20s, that is a type 2 diabetes.
I was going to ask you about that, about we have type 1 and type 2. Yeah.
Yes, so, and even apart from the type 1 and type 2, there are others. We have the gestational one and others.
Yes.
Yes. So in the children, it is the type 1, which usually is lack of insulin produced. So as I said, when one taking anything carbohydrates and it's broken down into glucose, the pancreas is supposed to release this hormone which is called insulin. And the insulin have gates, which is the they help with the transportation of the glucose that is in circulation, from digestion. It's able to transport it from circulation into the various cells. So the sugar that we're taking in, which is broken down into glucose, is supposed to be utilized by the cells.
Okay.
Yes, but in a process whereby there is inadequate or the total lack of the insulin to transport or work on this glucose, then there is excess of the glucose in circulation. And of course, physiologically, there is a level that is supposed to be in circulation, but the majority of it is supposed to go into the cells for cell growth and energy utilization and all these. But when all these fails, a majority of it is still stuck in circulation in your blood, instead of going into the cell, then we diagnose you diabetes. So it happens in both adults and it happens in children. And even there is one particular one that occurs in children as young as from birth to 6 months.
Okay.
Yes, there is one type which happens in these children, and 50% of them grow out of it. And this is because of insulin resistance. But the 50% result in adult diabetes.
Okay.
Yes, I hope that's clear.
Yes.
Yes. So diabetes happens both in adults and it happens in young ones.
Young ones. Okay.
Yes.
Would you explain to us the difference between the type 1 and type 2 and even the gestational one?
Good. So when we talk of the type 1 diabetes, it's basically inadequate insulin produced.
Okay.
So it is either a total lack of it, a total lack of the insulin produced, or inadequate insulin produced.
Okay.
Yes, and the total lack or inadequate could be due to pancreatic damage, because the pancreas is the place for insulin production and secretion. So once the pancreas is affected, it means that especially the head, the pancreas is divided into the head, the middle part, and the tail part. And it is the head, the head part, which mostly produce majority of this insulin. So if there is anything that happens to you, it could be an accident, traumatic injury, it could be genetic mutation, it could be even autoimmune disease.
Okay.
Anything that happens to the pancreas that affects the pancreas and the site of this insulin production, it means that the insulin produced is either going to be inadequate or total absent.
All right. So
And when that happens, the treatment of it is that then there is going to be an exogenous provision of insulin.
Insulin, yeah. Okay.
Yes, and that is why that in type 1, it is always the injection of this insulin.
So all the type 1s are insulin dependent.
Yes, so in type 1, simple term, we say that they are insulin dependent.
Okay.
There are some too that, based on what we find, we combine the treatment, the insulin together with medication. But when it comes to type 2, mostly it's resistance to the insulin produced.
Okay. Oh.
So here it means that your fat, your muscles, your liver don't respond to the insulin that is produced.
Okay.
Yes, and this is based on varying degrees of insulin resistance, which include obesity, lack of physical activity. So as I said, sedentary lifestyle, diet, hormonal imbalance. It could be genetic. It could be certain medication that you are already on. And it resists the amount of insulin that are produced. So here we give medication to those receptors so that it enhances the adequate production of insulin. So the type 1, the type 2, mostly, depending on the severity, but most of them do well with early medication.
Okay.
But in situations whereby either late diagnosis or very worse diagnosis, then we tend to combine both insulin and medication.
Okay.
So that is a type 2. And when we come to the gestational diabetes, so during pregnancy, the placenta tends to release hormones.
Okay.
And part of it, some of these hormones then directly attack or affect the insulin that is released. Or it enhances insulin resistance.
Okay.
And with this kind, it's usually in pregnancy.
Okay.
That is when the placenta, the hormonal imbalances and all these things result in resistance to the insulin that is produced, and therefore the person's sugar is not well regulated. So mostly the person will come with high sugar level, and most of them after pregnancy and the uterus go back to its normal physiological state, then there is a reversal.
Okay.
So the gestational is mostly due to pregnancy, and they mostly reverse after pregnancy.
All right.
So these are the common types of diabetes mellitus.
Okay. Thank you very much, Doctor. So we are still listening to Akoko Africa Radio UK. This is Health Talk with Na Atswei. Today we are discussing diabetes. So far, we've been told what it is and the types. And the main three types Doctor has said is type 1, type 2, and the gestational one. So please, Doctor, you said something about genetics. Would you say if some, like you have your parents or you have a family member who has it, the possibility of you having it is high?
Right. So when it comes to the role of genetics here, or even with diagnosis of diabetes, family history is very, very important. Once your mother, your father, that your parent being diabetic, it increases the risks for you becoming diabetic.
Okay.
If your siblings, if you are a twin, and it's more commoner in identical twin, if your other twin is diabetic, the risk increases. If it's a fraternal, it increases but relatively lower. Then it comes to your other siblings. Then it comes to your parent. So your immediate family, if any of them is diagnosed diabetic, then your chance of becoming diabetic yourself is high.
Okay.
So then it means that you have to be careful with all the lifestyle modification that will come when we are dealing with the management. You ought to be careful with those.
Okay.
Either than that, you also fall into it. And as I said, it's a chronic condition. We manage diabetes. We don't treat diabetes.
Okay.
Like somebody have malaria, you give anti-malaria for 3 days, and the parasites are out of the bloodstream. Diabetes is managed. It's not treated. So once there's family history, it's a red flag.
Okay. All right. So, how is it diagnosed? How
Good.
can you,
So when it comes to the diagnosis of diabetes, there are would you want to look at the clinical presentation first before the diagnosis?
Yep. That's fine.
Yes. So the clinical presentation, the common three things, we have 3 P's. That is polydipsia. That is, you become thirsty frequently compared to your previous moment.
Okay.
Yes, and then polyphagia. That is, you become hungry.
Okay.
So previously you are somebody who 3 square meals a day is okay. But once you see that the frequency with which you become hungry, you become thirsty is abnormal, then please, it's a red flag.
Okay.
So we have polydipsia, we have polyphagia, and we have polyuria. That is excessive urination. That is the frequency of urination. Maybe you are somebody that within 24 hours during the day you urinate probably 3 times, and at night you wake up, let's say, only once. But when you see that during the day you urinate excessively, the frequency is increased, or in the night, now the frequency of urinating has become high than previous, then it's a red flag, it's a suspicion. And then because these cells are denied of the glucose that is in the circulation, the cells don't get the necessary energy and the calories from what you eat.
Okay.
So it means that the cells will shrink and eventually you lose weight. So when there is an unexplained weight loss, coupled with these 3 P's that I mentioned, increased thirst, there is frequent urination, there is frequent or increased appetite or frequency of feeding, then there is a suspicion. When this is accompanied with unexplained weight loss, then please, it's an enough ground for you to rush to your nearest hospital for it to be investigated. The other common symptoms are fatigue, unexplained tiredness, because the cells don't get the necessary energy that they require. You become easily tired, and then because it hinders the peripheral circulation, especially your extremities, your hand, your feet. It means that whenever there is a cut there is no healing process.
Okay.
So whenever you see that there is no healing cut and sore accompanied with the earlier symptoms I mentioned, then please, that one too is a red flag.
Okay.
And then as part of the complication, diabetes retinopathy. So it affects the retina of your eye and your vision becomes blurred.
Okay.
So that one too is also a red flag. So when you see these symptoms that I've mentioned, and then as part of the complication too, there is peripheral neuropathies. And it will lead to numbness and tingling sensation in your extremities, especially your hand and your feet.
Your feet. Okay.
And then in the female, mostly, because it's a chronic condition, it tends to affect your immune system. So you realize that now you become more prone to infections. Commonly vaginal infections.
Like thrush.
Yes, like thrush, vaginal thrush, and the others, and even sometimes skin infections. Because it's a chronic disease, it affects your immune system, and once your immune system is compromised, your response to infection and all this. So previously, the common bites or the microorganisms on your skin that will not cause any problem, because there is reduced immune system, then they become a threat to your health.
Okay.
Good. So these are the symptoms, the common symptoms or red flags of diabetic mellitus. When these things show up, please run to your doctor, run to the hospital. And when you come with the complaint of any of these at the hospital, we then do investigation. So then it brings us to to the diagnosis.
Okay.
How is it diagnosed? So the first thing is that we do a needle prick to test your blood sugar. The preferred one is fasting blood sugar. Depending on wherever you are, the unit may be in milligram per deciliter or millimole per liter. So we have a normal range.
Okay.
If it's more than the normal range, that is the fasting blood glucose.
Okay.
Then we will do what is called random blood sugar. That is at any time, even after you've been fed. So the fasting is you without breakfast.
Okay.
And the random is any time of the day, even when you are fed. So that one too, we have a normal range that we look at.
Okay. And what
And
are
then-
the normal ranges?
Yes. So when it comes to the fasting blood sugar, we are looking in millimole, we are looking at 3.5 to 5.5 millimole per liter. That is the common standard unit that is used universally.
Okay.
Yes. So when it is more than 6, then we will say that that is pre-diabetic.
Pre-diabetic. Okay.
Yes. And when it is more than 7 going, then we can say you are diabetic.
Okay.
But we don't base on just one check. Minimum 3 checks. If there are no signs and symptoms that I've mentioned earlier on, at a week interval of each. So that is the fasting blood sugar. And the random blood sugar at every point in time when randomly, even when you are walking on the street or at work or whatever, when we check your sugar level, we look at a range between 7 to 11 millimole per liter.
Okay.
So anything that is more than 11, then it's a suspicion.
Okay.
And then the most important one, which is glycated hemoglobin, or HbA1c. So that one gives us a fair idea of how your glucose level is within a period of 3 months. So it's prognostic parameter. That is when you've been diagnosed and you are on treatment. We use the HbA1c to see how the control is doing within a period of 3 months.
So that one is a proper blood test, not like the needle prick.
Yes, so that one is a blood. We take a blood sample and then we send it to the lab for it to be done.
Okay.
Yes. However, when you present and we think the suspicion is high, and we want to bear and bear, and this is mostly done in the pregnant women. We call it oral glucose tolerance test.
Okay.
So that one we give you glucose. That is the unit of carbohydrate. And we measure your blood sugar every 30 minutes.
Okay.
Yes, we do that between 4 to 6 times, and we look at how the graph is. And from that, we are able to determine whether you are non-diabetic, you are pre-diabetic, or you are diabetic.
Okay. All right.
Yes. And then the last one is your urine. So we are also able to take urine sample. And the urine sample will tell us the glucose level in your urine. In the normal person, glucose should not be able to cross your glomerular filtrate, that is your kidneys. It should not be able, the size of it, the molecular size is so high that it should not be able to cross your glomerular filtrate.
Okay.
But in diabetic, the complication goes to affect their kidneys. So the pores that check this become loose. Then they tend to even excrete the sugar in the urine. So when we do the urine test, we are able to see glucose in the urine. And apart from that, because it's a multi-systemic disease, right from your head to your toe, every part of your body, as part of the complication, can be affected. And because of that, as part of the modalities, they do other labs to be sure of your heart, your kidneys, your liver, your cholesterol level, and all these things. So we use, all these are part of the diagnostic criteria that is used for diabetes. But the most important thing are the specific one which I mentioned earlier on: the fasting blood glucose, the random blood glucose check, the glycated hemoglobin, the urine, the urine glucose level. These are the specific diagnostic modalities that are commonly used.
Okay. All right. Thank you very much, Doctor. So our next question is treatment. What are the various treatments we have for the diabetes?
Good. So when we come to the treatment, it's a multidisciplinary approach. In a proper health setting, it is not a one-man show. It's a multi-systemic. So you need to your primary physician, your endocrinologist, your internist, and all these things. Sometimes even physiotherapies and all these disciplines come in. And most importantly is the nutritionist, because the treatment varies depending on one, the investigation findings, and then if there are complications, and then the last one is the prognosis of it. So the primary physician will diagnose it, will start the treatment, and will be monitoring. That is the prognosis, how it is going. So the common medications that are used in the hospital, that is the anti-diabetic medication. So once we are, based on clinical grounds and investigation, we establish that you are diabetic, then we can start you on oral diabetic medication. And then, like I said, the common one being metformin. And like I said, the type 1 and some of the type 2, those ones are insulin dependent. So they too will depend on insulin. That is injectable insulin. And yes, with a syringe, that is the insulin pens, the insulin pumps, the rapid acting inhaled insulin. And the most important and the primary thing is dietary. Yes, so that is there should be a change in your behavioral lifestyle. It is a therapy on its own, right from your eating. So it means that what you are eating becomes very important. The amount of carbohydrate you are taking in. So you need to plan your meal, and it is mostly done by the dietitian.
Okay.
So that your meal will have the right proportions. Like in Ghana and in our part of the world, most of the common available food items are carbs.
Yeah.
So you look at the proportion of the carbohydrate to the protein to the fat, and then the vitamins and minerals. Yes, so it means that as much as possible you want to reduce the carbohydrate intake. So if it is rice you want to take, you want to try as much as possible to do less with the white rice, the white polished rice. It is very, very high caloric and it is caloric dense.
Okay.
Yes, and then if it is rice you want to eat, instead of plain rice, then you can go for wake, that is the local diet rice with beans.
Okay.
So here the beans is a protein. Yes, but it's going to supplement the rice so that the amount of the rice is reduced.
Okay.
Yes.
Makes sense. Yeah.
And then even if it is just a plain rice, then you are looking at the quantum with more vegetables, so that the bulk is not changed, but the caloric dense is modified.
Yeah.
So instead of plain rice with stew and your chicken and or what have you, if it's previously 3 ladle of rice, then you can do 1 ladle or 1.5 with more vegetables added. Yes, with more vegetables added, so that the bulk is the same. You feel satisfied, but the content of the carbohydrate is relatively lower than before.
Okay.
And then the food that is high caloric dense, if it's a part of the world like apart from the rice, the yam, the cassava for fufu, the gari, and the other varieties of mutuo, they are all rice, rice water, and all these things. So instead of rice water for your breakfast or a Milo beverage for your breakfast, because the Milo beverage, whether you are adding sugar or not, all breaks down into sugar. Carbohydrate. So instead of that, or a Lipton with added sugar, then probably you would want to go for oatmeal, which is high in fiber.
Okay.
But the caloric dense is relatively lower. Yes, and then the cereals, like the maize. I mean, so maize porridge preferred to your Milo beverage or Lipton with sugar. And then for your lunch, instead of plain rice with stew or jollof rice with whatever, even if it is jollof rice, you want to be conscious of the caloric content. Yes, and supplement it with more vegetables. And then the beans, we have our bean stew with fried plantain. So these food are preferred to the banku and the fufu and all these high dense caloric carbohydrate food that we take.
Okay.
So we are not saying that you should stop those food, but you minimize the frequency of the intake and then the quantum of it.
Mm.
And then you are also looking at your time. After 5:30, you should not take anything that is heavy.
Okay.
And by way of that, that is by 5:30, you should be done with your supper.
Mm.
Because once you are eating late, effective digestion is hampered, and it stresses the body. Because as part of the digestion process, the carbohydrate parts are checked by the insulin that is secreted.
Okay.
And when you are sleeping, your gastrointestinal tract system should also rest.
And not be digesting things.
And not to be digesting things. So it is very important that if you are somebody with a strong family history, maybe your both parents have diabetes or were diabetic, or your elderly siblings are diagnosed diabetes, this is the time for you to be on the watch for whatever you take. And the important culprit of it is the carbonated drink.
Okay.
The fizzy drinks. These are high caloric index.
So the Coca-Colas and the Fantas and
the Fantas and the Sprite and all these carbonated drink, the fizzy drinks, please.
How about alcohol?
Yeah, so alcohol is also one of the risk factors. When we look at the risk factors for diabetes, so family history is on top. Alcohol, smoking is another great risk factor for diabetes.
Okay.
And hypertension. So alcohol too is also, because alcohol as it breaks down is also ethanol, it's sugar. Yes. So they all go a long run to affect your insulin production. So all these things are, especially your dietary, is very important. And then exercise, like I said. So sedentary lifestyle. You are a mommy, you are a daddy, whenever you get to the house, hey, Kofi, bring me that. Mommy, bring me that. And maybe you are a boss at the office. Anything, anytime is the secretary who is going for it. Please, it will not help you. Sedentary lifestyle is very, very great corporate. So let us look at it. At the office, you can probably time yourself every hour. Just take like 10 minutes stroll. So all these things are balances that helps you to increase the metabolic activity. And as the metabolic activity is increased, then it increases the insulin sensitivity.
Okay.
And it even leads to high production of the insulin. Yes.
Okay.
So these are the very few things I'll mention for now.
When you were talking about having your last meal, like your supper, you said maybe by 5 p.m. you should have your dinner. What if after 5 you are sitting down and you get hungry? Maybe you decide to take some fruit. Which fruit would you say because I know some of the fruits too are high, they stay in sugar.
Yeah. Yes. So at that time, if yes, probably you were at work, I mean you are big by time or anything like that. So that is not time for Milo beverage because it's a sugar. I mean, probably you are going to add bread and all these things will break down into sugar, and it just stuck in your circulation. Yes, so you want to probably consider oatmeal, oatmeal without sugar and without milk.
Okay.
So it means that you have to learn to control your tongue. Yes. Sometimes it may not taste nice, but if you are somebody who is health conscious, you just eat it so that you can get some energy in there. That is not a time for Coca-Cola or Fanta and say that, oh, this one is light. If you have vegetables, you can do that. Cabbage, carrot, cucumber, yes, you can do that. And then you asked something at the tail end. I've forgotten about that.
Yeah, I was asking if we should avoid fruits, like, you know.
Yes. So most of these fruits, though they are natural, but yet they are also they break down into another form of sugar. Mostly sucrose. And in excess, it also affects your sugar level in circulation.
Okay.
So please don't deceive yourself that when you are taking like 5 fingers of banana, you think you are doing yourself good. Yes. So these sugars are also real.
Okay.
So we need to take them in the right proportion.
All right. Thank you very much. We are still listening.
But in the evening, if you are late with dinner, please go for fruit. I mean, go for the veggies. That will help you than the refined carbohydrates.
Carbohydrates. Okay.
Right.
Thank you. You are still listening to Akoko Africa Radio UK. This is Health Talk with Atswei. We are still on the topic of diabetes with Dr. Sasu. Doctor, how do you manage diabetes in Ghana? Like, okay, in this place where I work, all our diabetic patients, once a year we bring them on for review.
Okay.
So we check their medications, we do their blood tests, we do their food check, and all the other stuff. Every year they come in, depending on where their levels is. Some of them comes twice in the year. How is it done in Ghana? Is it managed?
Right.
Yeah.
So in Ghana, once you are diagnosed by your primary physician, then we have started management tailored to what was found. So if there are complications involved, then all these things are factored in. However, we review them based on their prognosis, how they are responding to treatment. So initially we give them short intervals for review. That is depending on how the control is going. So maybe I see a patient today, and after the workup, diagnosed, started treatment, maybe I would like to see that patient in a week or two, depending on where he or she is coming from.
Okay.
And the social history, what he or she is doing. If he or she is able to afford certain things, then I would like to see them next week with a lab.
Okay.
To see how the control is going. However, if socio-economically unstable, then I would want to see in 2 weeks or 1 month. Yes, to see with some labs to see how the control is going. And then as we progress, we give them from 1 week, 2 weeks, we give them 1 month review.
Okay.
And then if these are people who are serious and doing well, then you increase the interval and the medication prescribed. Yes, because the newly diagnosed, if you give them let's say 3 months medication, maybe they will not come until the medication is finished. Yeah, so you would want to prescribe for 1 month maximum, so that when it's finished, they can come for review with labs to see how the prognosis is going. And then if everything works out well, then you can increase it to 3 months, sometimes 6 months, if they are doing well. Yes, but we don't have like a year kind of. So as I said, there are complications related to diabetes. We have microvascular complication and we have macrovascular complication. When we talk of the microvascular, we are looking at the we are looking at the myocardial infarction of your heart. We are looking at the retinopathy of your eye, as I mentioned earlier on.
Yeah.
We are looking at yes, your kidneys. That is diabetic nephropathy. We are looking at your kidneys. So these are the microvascular complications. And when we talk of the macro, we are looking at the peripheral vascular system. That is the neuropathies.
Okay.
Yes, so some of them will come with the complaint of tingling and burning sensation and all these things. So all these are part of the complications. So if it is somebody with retinopathy, blood vision, then of course you'd want to refer to see an eye doctor.
Okay.
If it is somebody with heart complication, then you would want to do a ECG, you would want to do some other investigation, and if possible, refer to a cardiologist.
Okay.
So depending on the complication, we tailor their reviews.
Okay.
Yes.
All right. Thank you very much. I have seen some patients, like when they are pre-diabetic, they come back and they are fine. Would you say type 2, are they able to go back to normal, or you can't when it gets to type 2?
Yeah, so type 2, as I mentioned, type 2 is managed. It is not treated.
Okay.
But once you do well with all the education, your behavioral lifestyle, your eating habit, your physical activity habit.
Okay.
Once you look at all these things and you are doing well on medication, then the prescriber or the medical person is going to review you with the labs.
Okay.
And not just the labs, but holistically, your medical approach.
Okay.
So there are people who do well. We start them on high doses of the anti-diabetic medication. With time, we bring it down, and even there are some that even do well, are able to discipline themselves to the point of even the medication, we even give them every other day.
Okay.
Every other day. And even some of them, maybe just twice in a week.
Oh, okay.
Yes. But for you to probably get to low figures and think you are fine, and because of that, you think that you are treated, please, it's a big lie. We know of people who we started them on medication, they were doing well and living their normal life, and stop medication, and after some few months came with complications such as stroke.
Oh.
Yes, so I didn't mention that, but stroke is also one of the microvascular complications of diabetes. Yes.
How about blood pressure?
Yeah, blood pressure. So it's a group of diseases. We call them metabolic syndrome.
Okay.
Diabetes, hypertension, cholesterol, gout. So all these are metabolic syndrome. When you are diagnosed with one and you are not properly managed, they tend to open gate for the others
to come in.
Exactly. So maybe you may be started with diabetes or hypertension. If you are not properly diagnosed and treated, with some time to come, about a year or two, you may end up with cholesterol issue, with hypertension issue, and other issues.
Okay.
So they work together.
They work together.
Exactly.
Okay, doctor. Thank you very much. We will check if we have any questions for you on our website, but we would like to hear from our sponsors whilst we look for the questions that they have for you. I have so many questions here at the moment.
Hey there, fabulous folks. Are you ready to take your locks to new heights of beauty and vitality? Then listen up, because Tiny Hands Locks is here to make your hair dreams a reality. Located at the heart of natural beauty, Tiny Hands Locks isn't just a salon, it's a sanctuary where your locks are pampered and celebrated. Now, let's talk about our top-notch hair care services and products. At Tiny Hands Locks, we believe in the power of nature's bounty to nurture and revitalize your locks. At Tiny Hands Locks, we are dedicated to crafting bespoke lock styles that enhance your natural beauty and reflect your unique personality. From starter locks to locks maintenance, we've got you covered every step of the way. And when it comes to products, we've curated a range of natural wonders that are sure to leave your hair feeling pampered and rejuvenated. From clarifying shampoos to revitalizing conditioners, each product is meticulously formulated with nature's finest ingredients to cleanse, nourish, and protect your locks. But wait, there's more. Visit our website at www.tinyhandslocks.co.uk to explore our full range of services and products. Located at 24 Swan Close, Feltham, TW13 6PA. Just give us a call at 0783 298 9531 and we'll take care of the rest. So what are you waiting for? Treat yourself to the luxury and care you deserve with Tiny Hands Locks. Because at Tiny Hands Locks, we're not just about hair, we're about empowering you to embrace your natural beauty and shine from within. Discover the magic of Tiny Hands Locks today.
When it comes to balloons and balloon decoration for your baby Christian, for your silly floral, Smile is the place to be. For your wedding setup, your beautiful wedding setup, backdrops, and everything when it comes to planning, coordinating, and delivery, Smile is the best. For your indoor programs, for executive programs, for corporate events, Smile is the place. Call us and we shall give you the best of services. Our telephone numbers are 0242571 and also 0243639381. So social media handles are IG Usman Events on Facebook, Usman Events, and also on TikTok, Usman Events. Come and let's do business, and you never regret it. You smile. Satisfaction is our hallmark. We make sure we deliver, and our delivery is also quantity.
Hello, we are back and we have a few questions here for Dr. Sasu. The first question is from DJ Kobe. What should you do if you get sick and cannot eat your regular diet? If you are on diet and you don't feeling well, what should you do?
So as in you are not well and not able to take in what you are required to take.
Yes. So like you said about you going to a dietitian, maybe they've given you a diet to follow, and then you're not feeling too well. What should you do?
Yeah, so I think you should discuss it with your primary health care giver. So that, I mean, it's a team thing, so that you all look at it and see how best you can go about it. Because if you are not well and the unwell is relative. Yes, and if it's infection or any of these things, apart from you going into hyperglycemia, you can also go into hypoglycemia.
Okay.
Yes, and the hypoglycemia is even dangerous than the hyperglycemia. So when I say hyperglycemia, I mean high level blood sugar. And when I say hypoglycemia, that is low level blood sugar. That is your blood sugar being less than 3.5. And that is a medical emergency. Yes, because hypoglycemia will even kill you faster than hyperglycemia.
Oh, really?
Yeah. So we advise our patients that are, especially those who are on insulin, will always get this carbonated or fizzy drink, at least just one bottle in your fridge for emergency. Yes, because yes, the common symptoms for you to know you are going into hypo is that you become confused. You sweat a lot, and you become restless. Yes, and you feel there is an impending doom. You are not so clear of yourself. So please, if you see any of those symptoms and you are a diabetic patient, you are on medication, please have your sugar checked. And as a diabetic patient, you always ought to have a glucometer by your bedside. So that emergencies you check. If it is low, unrecordably high, then you know what to do.
All right.
Yes.
Okay, thank you. The next question is from AC. She said, how do you make sure your blood sugar stays at a healthy level? Does cloves help?
Does
cloves. Clove.
Oh, okay.
Yeah.
Right. Yeah, so we've heard of that, but clinically we don't have medical literature to back that.
To back it up.
But
Okay.
yes. So what to do is what we mentioned. Your checking of what you are eating, your time of eating, your activity, physical activity, and taking your medication regularly is very important. It's very important. In the developed countries, people live with diabetes into the hundreds, after hundreds, they live their normal life. Yeah, so once you are diagnosed, you are on your proper medication, please, you live your normal life.
Okay. All right. So that even answers the next question. So is it true what you eat matters?
Very, very.
Yeah. Okay. All right. So my next question is from Juliet Mill. She's asking if grapes are okay.
Yes, grape is good, but we are looking at the quantum of what you are consuming. Yes, because there is a little bit of sugar in it. So you don't want to take it in excess.
Okay.
Yes.
Okay. So Juliet Mill says that this is so true. This happened to my brother-in-law, diabetes too, and he brought it down with the right diet. So that's not a question, but she's telling us about the diet.
Right.
Yeah. And I think this is DJ Kobe. So I eat grapes every day as fruit. Is it okay? Everybody's talking about grapes today.
Yes, as I said, grape, it's part of those fruits that the caloric dense is relatively on the lower side. Yeah, so you want to check it. First of all, you want to know your sugar levels and especially your family history.
Okay.
If you are somebody from that background, there is a positive family history. We check your sugars and you are the borderline, then you want to regulate it.
Okay.
You want to regulate it, yes.
Okay, thank you.
But if you check all this and you are fine, then you are good to go.
Okay. Thank you very much. So, DJ Kobe, you can have your grapes, but in moderation, like you said. Juliet says she loves grapes, but Juliet, you heard that as well. And then she says, thank you. At the moment, I don't have any more questions, but if you have any questions, you can still send it. Dr. Sasu is here. He'll be leaving us soon, but you can bring your questions while we try to finish the program. So from what we've learned today, it's quiz time. Like, I'm going to talk about what I have learned so far, what diabetes is, and how we can manage it. I know we have type 1 and type 2 and the gestational one, and some of the things mostly depend on our lifestyle, weight related, how much we exercise, the food we eat mainly. All this contribute to that. And there's one thing that doctor said that is a bit very, very important that we need to look into is when you have one of these illnesses like diabetes or high blood pressure, and it's not managed properly, it brings the rest. They are like relatives. They come together one after the other, and that becomes very problematic. So we have to check what we eat. We have to check our symptoms. When you find something you are not comfortable with, you have to go and see a doctor and make sure it's checked out for you so you can have your own peace of mind.
Right.
Did I learn something today, Doctor, from what I've said so far?
Right. That's perfect.
Okay, is there anything else you would like to add to what we've done today?
Yeah, so once again, I'll reiterate it that diabetes is now becoming a global concern. It's becoming a pandemic syndrome.
Okay.
And it's on top of the non-communal diseases. It's becoming really a big deal, and it's based on our lifestyle. So please, let's be sure of what we are eating. If you don't eat as you are taking your drug, you need to take your drug as you are eating.
Okay.
So please, let's be sure of what we are eating. Let's eat right, both in quantum and time. And then let's be abreast with knowledge and education. And those of you from a strong family history, you can still escape it if you are able to discipline yourself well, especially with your diet and your physical activities.
Okay.
So please work on it, and I know by God's grace, as you do your part, the Almighty God will also keep a check on you, and you shall live a fulfilled life to see all your dreams come true in the name of Jesus.
Amen.
Amen.
Amen. Thank you so much, Reverend. Thanks for coming, and thanks for all that you've taught us today. And we hope you come back soon with another interesting topic. From all of us at Akoko Africa Radio UK, we thank you, and we wish you a nice weekend.
Thank you.
And it's bye from us now.
Hey there, fabulous folks. Are you ready to take your locks to new heights of beauty and vitality? Then listen up, because Tiny Hands Locks is here to make your hair dreams a reality. Located at the heart of natural beauty, Tiny Hands Locks isn't just a salon, it's a sanctuary where your locks are pampered and celebrated. Now, let's talk about our top-notch hair care services and products. At Tiny Hands Locks, we believe in the power of nature's bounty to nurture and revitalize your locks. At Tiny Hands Locks, we are dedicated to crafting bespoke lock styles that enhance your natural beauty and reflect your unique personality. From starter locks to locks maintenance, we've got you covered every step of the way. And when it comes to products, we've curated a range of natural wonders that are sure to leave your hair feeling pampered and rejuvenated. From clarifying shampoos to revitalizing conditioners, each product is meticulously formulated with nature's finest ingredients to cleanse, nourish, and protect your locks. But wait, there's more. Visit our website at www.tinyhandslocks.co.uk to explore our full range of services and products. Located at 24 Swan Close, Feltham, TW13 6PA. Just give us a call at 0783 298 9531 and we'll take care of the rest. So what are you waiting for? Treat yourself to the luxury and care you deserve with Tiny Hands Locks. Because at Tiny Hands Locks, we're not just about hair, we're about empowering you to embrace your natural beauty and shine from within. Discover the magic of Tiny Hands Locks
Your
today.
smile is the place to be for your wedding setup, your beautiful wedding setup, backdrops, and everything when it comes to planning, coordinating, and delivery. You Smile is the best. For your indoor programs, for executive programs, for corporate events, You Smile is a place to be. Call on us and we shall give you the best of services. Our telephone numbers are 0242571571 and also 0243639381. Our social media handles are IG You Smile Events, on Facebook You Smile Events, and also on TikTok You Smile Events. Come and let's do business, and you'll never regret it. You Smile. Satisfaction is our hallmark. We make sure we deliver, and our daily results of want. When it comes to balloons and
Hello everyone. You are listening to Akoko Africa Radio UK. This is Health Talk with Atswei. We just finished talking to Dr. Sasu. He taught us so much about diabetes. I hope you've learned something today. I have learned a lot. I hope you have learned something today. If you were not able to make time to listen to him, you can always go to our YouTube and listen to the topic, and you can send any questions you have to us, and he will be happy to answer them for you. We've so far treated a few topics: cancer in children, the use of antibiotics, kidney disease in children, hypertension, and today we've done diabetes. They are all there on the YouTube channel. If you want to listen to them, you can always go back. Also, if you are interested in any topic so far that we've not treated, you can send us message on our website and social media platforms, and we will try our best to bring it on for you. I hope you've enjoyed this, and we are bringing the show to an end. Thank you so much, and thank you to my producer DJ Kobe for good production. As you go into the week, I wish you have a good week. And if you see someone without a smile, give them one of yours. You may be making a difference in that person's life. Let's love one another. Have a blessed week, and bye from me. Bye-bye. Oh, before we leave, we have Shepherd's Hour tomorrow from AC. She has a powerful message for us, so let's make time with her. And there will be no Kobe show. Kobe show, we'll have to revisit Kobe show, and maybe discipline the presenter, because he has to come back. But please make time with AC tomorrow, and you won't regret it. We'll have a wonderful weekend and a nice week ahead. Thank you.
Health Talk Show.
Bye.
Your health, our priority. Join Atswei on the Health Talk Show. Listen every Saturday from 4 p.m. to 5 p.m. UK time on Akoko Africa Radio UK. Join Atswei on the Health Talk Show. Listen every Saturday from 4 p.m. to 5 p.m. UK time on Akoko Africa Radio UK. Health Talk Show with Atswei. Your health, our priority. Join Atswei on the Health Talk Show. Listen every Saturday from 4 p.m. to 5 p.m. UK time on Akoko Africa Radio UK.